You are listening to the Retina UK online Berkshire local peer support group meeting recorded Tuesday, 5th of July 2022.
Good evening, everybody, and welcome to the launch meeting of our Retina UK Berkshire local peer support group. We're very pleased to have you all come along and join us for this first meeting online on Zoom. Before we introduce our speaker for this evening, Steve Sanson, I'm going to introduce who we are very, very proud to have volunteering with us, and a warm welcome to our group facilitator, James Birtley. Over to you, James.
So good evening, everyone. And yeah, as Mark says, welcome to the first local peer support group for the Berkshire area. So I've got retinitis pigmentosa, as did my mother. So I got diagnosed 4 years ago, and I've been associated with Retina UK as someone who donates and someone who likes to read all the literature that they send. We came through the COVID era, and I thought it'd be a good idea just to get in touch with Retina UK, because I know there was lots of people that were quite isolated during this time. And I just said to Retina UK, what's going on in the area? It'd be nice to reach out to lots and lots of different people. And they said, hey, we're actually going to start these peer support groups. And I thought, hey, I'd love to get involved in this. And you might not be aware, but Retina UK are opening up these peer support groups all over the UK. There's actually a group active in Belfast. There's one in Midland, or East Midlands, Manchester, also Kent, and obviously tonight we're starting off in Berkshire. So my motivations for being involved here is I think it'd be a great thing to have some local peer support. It'd be very nice to meet some new people, talk about the challenges that we face in life. Also, it would be a great way to facilitate informational exchange and to help other people that are visually impaired and blind. So some of the other meetings that I said that are taking place across the UK at this moment, one thing that they've been doing is having some motivational speakers. So the one thing that I would like to get from this meeting, which I would like to run once a month, the first Tuesday of every month, between 7 and 8 p.m, is to have an invited speaker. And some of the other groups in the UK, they have had some speakers, including blind para-Olympians, people doing mountain trekking, and people doing sporting activities that are quite intriguing. But I'd like to take that opportunity to introduce our speaker tonight, who is Steve Sansom from Healthwatch, Windsor, Ascot and Maidenhead. Welcome, Steve.
Thank you very much, James. Really nice to come along as well, and hopefully you'll all enjoy the presentation as well. We'd all like to welcome you to the concept of Healthwatch. And you're probably all wondering, what on earth is Healthwatch if you haven't heard of it before? Well, it was established by the government in 2012 under a Health and Social Care Act as well. And it was established to help understand the needs, experiences and concerns of people who use health and social care services, and to speak out on their behalf, because there hadn't been any accountability to NHS decision makers, people that spend the money and stuff. And so there really needed to be some kind of regulatory body. So Healthwatch is a statutory independent organisation, and every council in England must commission a Healthwatch service. Right, moving on. What's our functions? Well, Healthwatch England basically was the first one that was set up as well. And what we actually do is that the Healthwatch England was created in April 2013 as the parent organisation, and it had three main goals: increase numbers having their say and provide clear information and advice to help those take control; to localise an effective high quality service to facilitate change; and to encourage more collaboration with professionals to improve planning, delivery and support. And guess what? COVID then struck. All this had to change, and you can download the new strategy as well. Then, of course, there is the role of the local Healthwatch as well. We obtain the views of people about their needs and experiences of local health and social care services and make these views known to those in the commissioning and scrutiny of care services. We provide information and advice and signposting to the public about health and social care services, council services and voluntary community services. We also provide local quality commission, CQC, with any concerns about health, social care and care home services. And we carry out something called enter and view. It's not actually an inspection, it's a legal thing where we can go into health and care services, including care homes, and collect evidence and report on what works well and what could be improved. Right, we'll get a bit of audience participation now. How many health watches do you all think exist in the UK? Any guesses? I can see a few like that. Well, if we go down to Paddy Power, put 4 to 1 at 2,361, 25 to 2 for 39.5. Any guesses? We have 155 that cover the whole UK and Welsh ones altogether as well. What do we do and how do we do it? Well, if you use GPs, hospitals, dentists, pharmacies, care homes or other support services, we really want to hear about your experiences. As an independent statutory body, we have the power to make sure NHS leaders and other decision makers listen to your feedback and improve standards of care. We can also help you find reliable, trustworthy information and advice. And last year, Healthwatch helped nearly 1 million people. And the ways you can feed back to us: surveys, face-to-face conversations, focus and community groups, phone calls, social media, emails, all those different ways. Let's go down to East Berkshire Healthwatch, which is the organisation I work for. We have 3 patches. We have Slough, we have the Royal Borough of Windsor and Maidenhead. They don't like being called WHAM because you all think of Club Tropicana and all those kind of hits and all that kind of stuff as well. So it's RBWM. And we have Bracknell Forest as well in the group at the same time. There is a small team of 4 of us all together. We have our head, which is Neil Bolton-Hilton, who's head of Healthwatch and holds responsibility for the organisations in East Berkshire, Hampshire, Portsmouth and Croydon. We have 4 Healthwatchers in the group. He's worked across the health and social care and local social enterprise agencies at both operational and strategic level. We have our leader, who is Tess. She's been with us since October 2021, and she got promoted a bit into the position as well. So she's been with us for about 6 months. There's Nick Derman, who looks after Bracknell Forest as well, and he's the engagement lead. There's me, who looks after the Windsor, Ascot and Maidenhead patch, and I'm the volunteering lead for all the volunteers as well. And we've got a new member of staff starting very, very soon as well, who's going to be looking after the Slough patch as well. The priority for us is on engagement. And I've been doing about 60 visits, talks and various things in the last 6 months as well, just to get our name out there, because not people, I think the COVID has taken its toll and many organisations and stuff are struggling to get their name out there. So it's great to be able to promote ourselves to people like you as well. Anyway, you're probably wondering what we do. Well, we had a very interesting project around December time where we investigated 83 GP access websites, and 4 of us spent a few interesting weeks looking at all the individual websites, rating them, and then making ideas about how they could be improved. And getting an appointment was really like driving around Spaghetti Junction using a Boy Scouts compass. And you probably all know that it's very, very difficult at the moment as well. Another piece of work we did was Mind the Gap, where we had a look at the services for South Asian carers via a survey across that particular borough. It turned out that 86% of those questioned found that those questioned were totally unaware of the carer support services that were had for them. Again, it proves there's a lot of ignorance out there and people just don't know what to do. We've just done a questionnaire on hospital waiting times as well, and we're just about to go down in the mouth for an NHS dentistry survey as well. Yes, you can probably guess my script writer's getting sacked as we speak. But we also need your help. We need volunteers to help us at Healthwatch as well, that want to make a difference at health and social care. So if you know of any volunteers, we've got loads of different things going on as well. We want you to share your feedback with us as well, because that's how we form our investigation. You can invite us to your local group, you can visit our websites, you can call our hub, or you can message us at any time as well. We really want to get out there and visit you and find out what's really going on. And I have done some visits to visually impaired groups and societies, and I really do think you are rather negated sometimes as well. So it's now certainly the opportunity to reach out to us as well and contact us with any issues that you think are there that we should be knowing about as well. But as is mentioned, we are getting voluntary volunteers at the moment to come and help us. One to be a Healthwatch champion, Healthwatch ambassador, a social media and CRM ferret. Of course, when I think of ferrets, I think of Compo and Last of the Summer Wine. You can become a Healthwatch board member and Healthwatch quality voice, which is what I was talking to you about earlier, where you can actually go into a care home or something like that and actually start making inspections and recording various things about that as well. We do have a team at the moment of volunteers. We've got about 11 that are going to be helping us out fairly soon, and about 17 waiting to be inducted. We've found that we've got a lot of youth and young people that want to join us and sort of have their say. And there's certainly a gap in that market where we want teenagers and everything to have a say about their health facilities and everything as well. It's very important that we listen to everyone as well. Right, only a couple more things to mention about Healthwatch. If you go to any of our websites, healthwatchbracknellforest.co.uk, healthwatchwham.co.uk, or healthwatchslough.co.uk, you can sign up to our bi-monthly newsletter. It is totally free of charge, and we found that we're getting a lot of people now hearing about it and signing up for it as well. And you can send any articles, any content, anything like that. So Mark, if you want to send some to us, that would be absolutely fantastic, and we can include that in the next edition as well. Now, I'm not saying I'm on commission, but anyone signing up today will get a £5 and a pair of We Love Healthwatch socks. So log on today and get them all signed up.
No, that's brilliant. What we'll do is, if you've got any information that you can forward on to me,
yes,
Steve, we will put that into our follow-up email. Any links, telephone numbers, contact information, any surveys you've got currently running,
yes,
that may be something that our community might like to complete, anything to do with eye clinics, like you say, NHS waiting times, cataract surgery waiting times. I know they're on a bit of a delay, what with the COVID and everything. So anything, you know, to do with eye care literature that you may have, that our community might be interested in, then yes, please send it my way, and I will forward it on to our attendees and pick those that have registered this evening. That's brilliant. Thank you very much.
Yes, thank you. Thanks. That will be really helpful. So yes, thank you very much for doing that, Mark, as well. Yeah, simply now the thing is to invite you all to get in touch. You can write. Will said I'll send these the PowerPoint through to you, Mark, and you can circulate it. But we have offices down in Christchurch. We have a telephone number that anyone can ring, 0300 0120 084, Monday to Friday. But the means we've got websites at healthwatchslough.co.uk, healthwatchwham.co.uk, and healthwatchbracknellforest.co.uk as well. You can also, there's email, there is Twitter, there is Facebook, and there is Instagram as well. You can contact us via all that means as well. Right, well, I hope that's a very brief narration that has introduced you all. You can all wake up now, basically, like that. As I said, I was booked to do the Slough and Sognac Club, and I made them all drop off after 10 minutes as well. But I do hope you found the talk, as I said, narrative, informative, and informative, basically. And as Anne Wilson-Schreff commented, good health is something we can good health is not something we can buy. However, it can be an extremely valuable savings account. Thank you all very much.
Now,
Happy to take questions.
may I ask a question?
Lovely, thank you. Thank you very much, Steve, for coming at such short notice as well. That's
it was a bit thrown together, but I hope that was okay.
No, that was brilliant. Thank you so much for your time. I really do appreciate you coming on such short notice to stand in for Christine, who is unfortunately unwell and who emailed me earlier. So we do wish Chris a very speedy recovery, and will hopefully be joining us for the next Berkshire meeting to talk about what Berkshire Vision does, as what was originally planned for tonight's meeting. So thanks again, Steve.
My pleasure.
Oh, Jean, did you have a question? Sorry, Jean.
No, so I didn't know quite whether we're going to come in or not. I noticed Berkshire West was incorporated in that. Is there somebody that covers that?
It's a very good question there, Jean. Yeah, there is a Healthwatch West Berkshire. It's all to do with the parent companies. To elaborate a little bit more, we're part of a group called Help and Care. And they have several other things that they do, which includes dementia support, Wessex Voices. There's a gardening service as well involved with there as well. And they run 4 Healthwatches, which is My Healthwatch, Healthwatch Hampshire, Healthwatch Wiltshire, and Healthwatch Croydon. And Healthwatches in general change exceedingly quickly. We had 5 Healthwatches up to the end of March, but Healthwatch Wokingham the contract was given to another organisation, and so we went down from 5 to 4. And I did notice that we'll be around for 2 or 3 more years at the very least, because that's our length of our contract, but it can change very quickly as well. And you know, we have to not watch our backs or anything like that, but things can change very quickly, and it doesn't help when you've built up a big contact circle or anything like that, and then you sort of it's lost to another organization, really. But there we go.
That's what happened in Reading.
Yes, I'm not sure. Well, Reading was never part of East Berkshire. I'm not sure who runs West Berkshire. It's a separate company. As I said, Healthwatches all do the same thing, but they're run by different organisations.
Thank you.
And I'll give you another example in terms of we actually replaced the Arc in East Berkshire, which a lot of people still regard the Arc as you know, as a major loss kind of thing like that. So that's why we're having to sort of start now and build up our contacts quite quickly.
Thank you.
Jean, if you would like me to do some investigating for you to see who is the Healthwatch in the Reading area, I'll be more than happy to see whether I can do some investigating for you. That's not a problem at all. That's something you're interested in.
Yes, thank you. Yeah.
No worries. You're more than welcome.
Thank you.
Anybody have any other questions for Steve at all?
You're letting me off very lightly, everyone.
Has anybody had any experiences? I know we've all gone to see the eye clinic. The waiting time, sometimes you're there for 3-4 hours. And has anybody got any experiences or anything that they would like to address? If not, you can please contact me and I can forward over anything if you prefer to do it offline, and I can either contact Steve directly to get information to send over to you, or it can all go into the follow-up email and you can contact Steve directly yourself at a later date.
So I've got a question for Steve. So I just wanted to say that all of that was very useful. I didn't actually know that this sort of thing existed. So that's excellent. Thanks for bringing this to our attention. So you'll collect all this data, all these observations, and no doubt you'll feed it back to the relevant authorities to criticize the websites or whatever. So how do they normally take that feedback? Are they quite open to it, or can they be quite
very, very
defensive?
good questions, because we can sort of be biting the hand that feeds us. As I said, when I send you our publicity really does underline our independence, and that sometimes things that we find they might not like about hearing it as well, but we have to really, do as much research as possible, whether it's by surveys, whether it's by taking the feedback and everything like that, and use it as evidence to produce factual reports that ultimately they will take on board and everything like that as well. Because as I said, up to 2012, there was none of this accountability. And if they're going to be stuff they don't like, I think there will be findings like that. But sometimes the evidence that we collate will just prove something to them, kind of thing as well, and that they do act upon it like that, as I proved when I'm talking about the surveys and the websites that we did earlier.
Thank you, Steve. Thank you very much. Has anyone got any other questions, Steve? No.
James, is James raising his hand, or he hasn't got his?
Yeah, the other James has a question.
Oh,
I've got a question. Sorry, I hadn't unmuted myself.
sorry, James.
I can't see the symbol, so I forget. I've got a question and an observation. I hope you don't think this is too negative. I'll start with the negative observation, and then we'll have the question. When you mentioned Healthwatch, it was very familiar, because I thought in the past I had encountered Healthwatch, and I just looked it up. I met a lady called Ganji in February 2017, or Gargi, Gargi, at Maidenhead Blind Club. And she asked for feedback. I sent an email with my feedback. I heard no more. I left a message, and I never got a reply to my message. So obviously it's 5 years ago. The organisation may be better, but it's just an observation. And my question,
I can only apologise, James. Unfortunately, as I sort of mentioned earlier, these health watches change like very, very busy. So you are probably you might have been dealing with the ARC. I don't know the history of Healthwatch East Berkshire, because I know we came out of Slough. So it's obviously very important. We're working very, very hard to streamline our customer service, make sure everything is responded to.
okay. I know a bit about the ARC, but we'll pass on. The thing about the NHS that most bothers me is the organisation's failure to communicate with visually impaired people in an accessible format. And as I understand from the RNIB, they've got a legal duty to do it, but no one ever does it. I get letters when I'm expecting to get something in a digital format. I've had doctors tell me, like, hand me a letter and tell me to go home and read it at home, and I needed to read it in the hospital.
I have generally found from speaking with Berkshire Vision, and it's my personal experience, that people with visual impairments and the deaf or hard of hearing societies do get bypassed a lot. And for me, that's why when Retina UK they came onto my radar via Chris and everything like that, it was quite a high priority for me to reach out to as many societies, organizations, to make that contact and offer our support and our services as well, so that there is a way for you guys to raise issues, and for us to to log them and make a point of it like that. Because I do think people with sensory disabilities are rather let down, I think.
So I come under Frimley Healthcare, so I mean, I've asked them, and I just get I hit a brick wall, basically. And I haven't the influence that maybe your organisation might have in order to change their attitude, I guess.
Well, the more feedback we hear, we're hoping to, let's say, if I could say to Mark to do a return visit at some point, we can have a discussion and tape a focus group and everything like that, run a survey where I am getting some decent feedback and stuff that I can log and raise with those that commission us.
We are at Retina UK. We are working with many local sight loss organisations. We're working with Rovies, we're working with ECLOs, QTVIs, for their feedback, and not only that, to help educate as well, you know, for things especially around accessibility, because it is a frustration for many of us that don't do technology. They don't have the expensive equipment indoors. They might not necessarily know how to work a smartphone where you can download free talking apps that can read things like letters, etc. So we are trying to work with them to say, look, you know, if it's possible for paperless posting and paperless documentation to send it via email, which then can be used on screen, you know, smartphone screen readers or computer software, then that's the way that we're trying to do it. But it is a very, very slow process, and without feedback from our community as to know what is frustrating them out there. This is why Retina UK send out a sight loss survey every 3 years, and we've just finished doing our 2022 one. That is the only way that we get feedback, so we can actually support our community with the services and the information events that we actually can provide to our community, which I'll go on to in a little bit. Before the end of the meeting of what's coming up with Retina UK and how everyone living with inherited retinal dystrophy can actually get involved or get the support that they need from us. So, but yeah, it is difficult, and I'm a part of your the community as well. I know how difficult it is to read a letter, and naively, when it's just handed to you, it's like, go away and read that literature. It's like, well, I can't without the support of someone reading it for me. I know how frustrating that can be. So, but it is something that we are looking at, but it's just going to take time, as Steve's saying.
Yeah.
If
the last operation I had, I'm going to shut up after this. The last operation I had was a day surgery at Wexham Park Hospital, and I had a great deal of difficulty persuading everybody to recognise my sight loss. And I think the surgeon who was doing my operation, though it might have been someone else, when I explained it to him, he decided to move his chair closer to me and started shouting. And I said, well, I haven't got a hearing problem. I've got a sight problem.
It is, I think it's an educational thing. As frustrating it is my experience personally, surgeons and ophthalmologists and specialists, they're not one for being warm and gentle. They just give it to you bluntly, and I've had some terrible experiences, well, which I won't go into, and you know, to the point where I would rather not get support. I'd rather not get my eyes tested, and because I don't need to be feeling that way. So what you're experiencing is nothing that many of us haven't actually experienced. But once again, it's something that Retina UK is working to try and educate our specialists, our ophthalmologists, you know, our eye surgeons. You know, it's empathy, you know, but again, it's getting it out there to everybody, and that is why we are hosting our annual conference this weekend to our professionals on Friday the 8th, which is available online via our website links, or you can turn up in person. It's actually being held in Birmingham at the McDonald's Burlington Hotel opposite the New Street train station. And we also have our annual conference, which is on the 9th. So if anybody would like to learn more about inherited sight loss, like retinitis pigmentosa or rod cone dystrophy or cone rod dystrophy, then or Stargardt's, Usher syndrome, then please jump on to our website and I'll give full details in our follow-up email. We've got lots going on in terms of research, clinical trials. We've got some amazing speakers lined up. We've got a tech exhibition there with other companies talking about the latest technology that you can use for your office and your home life. There's lots to be seen if you want to go in person, or there's lots to listen to if you want to just watch it in the comfort of your own home. If anybody is new to Retina UK, we are a charity that is coming up to 45 years. We were in 2000, and it was 1975 we were established as the British Retinitis Pigmentosa Society. Then we moved to RP Fighting Blindness, but we wanted to support more inherited retinal dystrophies. So we changed our name in 2018 to Retina UK to support more retinal diseases in and around the UK. Like James said, we have 16 local peer groups that are now running either face-to-face or online. We do have a national support group now for anybody that cannot make their in-person meetings, and that is going to be held 4 times a year, with the next one being on the 29th of September. We recently just had our first summer one, which was last Thursday. All the recordings are now available on YouTube. If anybody's interested, just jump on and just type in Retina UK local peer support, and you will find a list of all the recordings that we've had from previous meetings around the UK. If anybody does want any support from us, we do have a telephone helpline which is open 9:30 in the morning to 9:30 at night, and that's Monday to Friday, and that is all manned by our amazing volunteers like James, who is facilitating this group. But we have specially trained helpline volunteers that are all living with inherited sight loss that can support you. Like I mentioned, we have a talking support service, so if you do need any kind of one-to-one telephone support, then you can contact myself and I can help you arrange a befriender. We can match you with one of our, again, trained volunteers that can help you in that respect. We have got other services that are being launched at the conference. Again, if you want to learn more about some of the other services that we provide, then jump on and have a listen to some of the wellbeing projects that we've actually got coming out this year. Like I say, if you want to get in touch with us, our helpline is 0300 111 4000, or you can call the office, which is 01280 821 334, or alternatively you can email us at info@retinauk.org.uk to find out more, or jump onto our website, which is just retinauk.org.uk. All of this will be in the follow-up email that will be coming out in the next few days. So if anybody got any further questions for either Steve, James, or myself regarding tonight's, or we can just have a little chat. We've got a bit of time. If anyone wants to have a chat and get to know each other, we're more than happy to stay on for a few minutes. We'll stop the recording so people can chat in the safety and the comfort without it being used online. So does anybody want to stay on and have a chat?
Could I just make one comment listening to James? I find sometimes if you're going back regularly to an optician and you sit through 2 hours of tests, the same tests over and over again, that might be something in 10 years' time you might need. I find it very tiring to go through the same tests if it's not relevant to just my eyesight. Does anybody else find that? you've got the field thing and all the photos, but sometimes I've known it take 2 hours to have tests. And you're tired by the time you get the eye test itself, you're very tired.
Well, I've been waiting personally for up to 4 hours, test after test after test, and I only go every 3 years now because there's not much that will change, can change. It's formalities now. But if anything does change dramatically, then I will go. But it's RP, it's a degenerative condition. It's managing it, and it's learning to accept it, which is obviously very, very difficult and different for everybody. You're all unique. We're all independent and different people. So that stage is different for all of us. So it is just how we manage that. So have you had one recently then?
Well, there was a series spread over 2020, going back every few weeks maybe, for the same eye test, and I still had to go through all the same rigmarole, and it's, I wondered if it was necessary. I could almost tell them what they were going to do next, just to see whether anybody else felt the same.
You said that was the optician, not the ophthalmologist, right?
Well, I don't know what they call it. Yeah, that was just sort of the, I would say, chain, and the condition hadn't been diagnosed, and it was just eye tests to see what it was, and they hadn't discovered up to that point. So I wondered if just sometimes weeks in between, whether I need to go through the same eye tests.
I think from a medical point of view, they like to see change. They like to see how a disease is progressing. I think it's the only way that they can learn from it. They learn from how it evolves, and it's the only way that they can not make a cure as such, but it's the only way they can learn. It's the only way they can research things for hope for the future. Yes, I've been prodded and poked since I was 10 years old, and every time I go to it, it's quite humiliating. It's not very pleasant. Nobody likes to field a vision test because it doesn't make you feel very good, and then you go all the way through that to find what the clinician's going to say to you, or the specialist is going to say. But sometimes it's reassuring when they say there's no change. That is always a good result. But not only that, there's so much coming along with things like unlocking the genetics, which is a sister part of our website, which came out of our last survey in 2019. The advances they've actually made in genetic testing and genetic counselling is absolutely phenomenal. So if anybody is living with inherited retinal dystrophy, and they're not sure the heritage of it, it is definitely worth speaking to your ophthalmologist for a referral, or your specialist, to see whether you can get genetic testing, because again, it shows how these conditions are growing, how they're evolving. And I'm the same. Only my brother and I are the only ones in our entire family that have got RP. It's such a bizarre thing, and with genetic testing and counselling, and it only comes through the amount of people that go and have regular checks. So there are pros and cons to your regular checks, but hopefully there will be more pros than there will be cons to it with the future coming up.
Okay.
Just as a general question, Mark, I'm having quite a lot of luck with a lot of networking across RBWM and SLAP. There's some great things going on out there in terms of, would you like me to pass on your contact or any events that you might like to attend, like networking forums and things like that, to help support the development of the group and everything?
Yeah, yes, please. Well, we've got information days coming up in September. We're going to be at Bristol, the beginning, the second week in Bristol, and Oxford we're going to be at, and also then towards the end of September we're going to be in Manchester and Hull. So, but we're always planning information days in different parts of the UK where we may have not have had an information day before. So if there is lots of networking we can do in, say, for example, in Maidenhead or Slough or Reading, you know, or any other part of Berkshire, then, you know, it may be something that we can put down and say, okay, we might not be able to do information day, but we might be able to do a seminar, or we might be able to do a webinar on something where we can invite other sight loss organisations. So yeah, networking is key for us. So as many contacts as you've got, then yes, please feel free to forward them on to me. That would be brilliant. Or share my contacts, that's fine as well. If you need any information, leaflets, or anything like that, please let me know how many you would like, and we'll get some out in the post to you as well, Steve. It's not a problem at all.
Superb. Thank you.
We hope you have enjoyed this recording. If you have any questions, queries, or wish to leave any feedback, then please leave it in the comment section below. Alternatively, you can send your inquiries to info@retinauk.org.uk. Contact us via the telephone on 01280 821 334 or call our helpline on 0300 111 4000, which is open Monday to Friday 9:30 a.m. to 9:30 p.m. If you would like to know more about our local peer groups, when your next meeting will be held, or if you wish to get involved in creating your own group, or would like to know more about our services that Retina UK provides, then please visit our information and support page on our website www.retinauk.org.uk and navigate to our local peer group page. Thanks again for listening. We hope to see you again soon. Take care and bye for now.